Good morning, everyone. This is chapter 10. This is our anti-infectives and another part of the anti-infectives, but it's the anti-tubercular drugs as well as the antifungal drugs we're going to be talking about in this chapter. So this is chapter 10, and it starts on page 157 in the book. Okay, so when we talk about tuberculosis, it's the most common bacterial infection out there. It's worldwide. It's caused by the bacteria called Mycobacterium tuberculosis. It is transferred by air droplets, so that's how usually people contact it. And if someone is contagious with tuberculosis, they can spread it to other people. So it's very contagious to anybody around that individual. Infected person, usually what happens, they will cough, they will sneeze, or even if they're having a normal conversation with you, air droplets are full of this bacteria, and then they release out through exhalation. And then what happens is a healthy person actually will inhale it into their lungs. Once inhaled, this bacteria will multiply in the lungs, and then usually what happens is will form a TB lesion. Okay, and that's usually inflamed small pocket of bacteria, has white blood cells and exudate, which is a lot of fluid that comes from the blood vessels. It happens into the lesion or the area of inflammation. So that's basically what these lesions are. The more white blood cells that form around this lesion and form a response known as a pneumonitis, which is basically inflammation in the lung, and especially in the alveolar area that will occur. A majority of the time, if you have a very healthy immune system, it can take care of this bacteria, and you would never know that you ever were exposed to TB. It will automatically do it on its own. We do develop immunity to this organism, and the bacteria becomes under control. So our body recognizes it and realizes it's an issue. The lesion, though, can form scars in the lungs. So over time, if you got an x-ray, they can actually see these lesions on the x-ray. And a lot of times they can realize that you've had tuberculosis in the past, even though you don't know it, but it can happen. Small percent of people exposed will actually develop active tuberculosis. The tuberculosis bacteria, it can enter into the bloodstream. And if that happens, that's when you're going to have really bad issues, because it's going to damage many organs. It will affect many tissues, especially the brain, the liver, kidneys, bone marrow. We know how important bone marrow is. We talked about that. But mostly, it's going to stay in the lungs. But it can get into the system and cause a lot of problems. Tuberculosis is very slow growing. It's not a fast growing bacteria. And it can take a long time to develop. A lot of times when people do, they don't realize they have it. It's because it's been in the system for a while. Usually how we diagnose tuberculosis is you can do a chest x-ray, and that's going to show if you have any scars in your lungs and that. You can do a sputum culture and actually check for that bacteria. You can do blood tests, and we also go by the symptoms. Okay, so if a person's complaining of certain symptoms, and we're going to talk about the thing, then they can start rolling out stuff. Usually symptoms that occur, symptoms, I don't know why I said symptoms. Symptoms that occur is usually a very persistent, productive cough. These individuals will start losing weight. They will have a decreased appetite. Night sweats, big time night sweats for these individuals. Bloody sputum, so they will actually start coughing up bloody sputum. They will be very short of breath. They will have a fever, chills, and also complain of chest pain, especially when coughing or taking a deep breath in. So usually when any of those symptoms, if there's more than one, they will start actually determining if it's tuberculosis. And they'll see if you've had a history. Now, we test for tuberculosis by doing a skin test. Example, the MAN2 test, tuberculin sensitivity test, Perquet test, or the PPD test, which is just purified protein derivative. And those are just the tests that we do in intradermal, and everyone had to have that before they started nursing school, but intradermal, and we inject about 0.1 milliliters of fluid containing this purified protein derivative. And it's a protein antigen that we inject under the skin of the forearm. Usually we read this test in about 48 to 72 hours. A positive test, and you can actually see what a positive test looks like, and that is on the following page on 158 in the little picture. A positive test is going to be at least 10 millimeters or more reddened area at the injection site that can be harder to that area than what it was before. Now remember, we usually have to test it about 48 to 72 hours because initially you can have redness to that area after injection. You can have some bruising. Sometimes if it is infected, you can have like some drainage and pussy drainage too. So that's not stuff that we want to do. So we want to make sure we read it in 48 to 72 hours because a lot of times people get a little bit of redness after having the injection done. And then they're like, oh, I got tuberculosis. No, you don't have tuberculosis. It's just that, you know, that's the initial incidence that occurs with injections on some people. So we always read it in 48 to 72 hours. And like I said again, 48 to 72 hours. And it's going to be 10 millimeters or more. The area is going to be harder than the surrounding area, and it's going to be reddened. Once you test positive, you will, the majority of the time, you will always test positive if you have the Mantoux test done. So usually what happens if you've tested positive in the past, they're going to require you to do a chest x-ray so they can actually look at your lungs. And that is usually what is going to happen afterwards, because once you test positive, you'll always test positive because you've had the history of that bacteria somewhere in your system and it was under control, but you were exposed. So it's always going to be positive. So anybody tests positive, chest x-ray would be the next route they would test you for. Positive test, like I said, means that that there was an exposure to the TB bacteria sometime in their life, but it doesn't mean that one will have the active disease and spread it to others. Okay, so let's talk about our medications. We're going to talk about our different stuff on our drugs here. And there's actually 4 out there, and how I remember it is the thing RIPE, R-I-P-E. So that's how I can remember my 4 meds for anti-tuberculosis, the first line. And usually with these, the first line, and that is on page 160, you're on these meds, and this is important to know, like how long you're going to be on these medications, but you're going to be on these meds for 2 to 3 weeks. This decreases the risk of transmission. You're not considered contagious if you take without missing a dose. So you have to take it at least 2 to 3 weeks consecutive. If you miss a dose, then you're considered contagious. If you don't miss a dose, then you're considered not contagious. But after that 2 to 3 weeks, you have to continue the med for at least 6 months. And after 6 months, you would continue until the tuberculosis is under control. So you're considered not contagious once you're on treatment for 2 to 3 weeks, continuous. If you miss a dose, then that's not a go. And then you're going to be on the treatment for at least 6 months. You can be on it for longer until the TB is under control. So that is something very important to remember. 2 to 3 weeks, consecutive doses, considered not contagious. At least 6 months or more afterwards until that tuberculosis is under control. Antibacterial drugs will not work because TB is slow growing, so it's not going to do anything if you take an antibiotic. And sometimes you need a combination treatment for it. But you must strictly follow the drug regimen. You must take it on time. You must take the doses as prescribed. Missing a dose is a no-no. And if you do, then you have to start over. You have to restart the regimen and make sure. So like I said, there are 4 types of the first-line anti-tuberculosis drugs. And like I said, I remember it as RIPE because it's easier. But isoniazid is probably the biggest one we give. Rifampin is another one. We have the pyrazinamide and we have ethambutol. Those are the 4 major first-line drugs for tuberculosis. And you can see that on 160. These meds are going to be bactericidal and bacteriostatic, except for ethambutol, which is actually just bacteriostatic. That is why ethambutol is prescribed with other tuberculosis medications, because it only has the bacteriostatic aspect of it. Isoniazid is the main drug used for the treatment of tuberculosis. That is going to be the #1 choice drug that they will prescribe first. Now, the side effects for all 4 of these meds, the common side effects are going to be nausea, vomiting, and diarrhea, headache, and insomnia. Okay, those are the major side effects, common side effects for all 4 of those drugs. Now, adverse effects. For all 4 of the medicines, they are very toxic to the liver. So liver toxicity is going to be a big time. It can cause damage. It can also cause liver failure. And we know if you drink alcohol or if you take acetaminophen or Tylenol, that can make it worse. So, of course, we would want to tell someone if they're taking Tylenol, do not take any more Tylenol or anything that contains acetaminophen or Tylenol, and definitely no alcohol at all while you're on this treatment, because it is all these meds are really bad on the liver. Now, we're going to talk about more specific for each drug. Those are the common side effects and adverse effects. Now, for each one, there's a little more that we got to go through. Now, isoniazid. Now, side effects for isoniazid, specific for that, is breast tenderness or enlargement in men. So a lot of times men will complain of getting breast enlargement, which will go away as time goes after they stop treatment, but they can get breast tenderness or some enlargement. Loss of appetite, sore throat, and problems concentrating. Adverse effects that are specific for isoniazid is peripheral neuropathy. And this is caused by a deficiency of the vitamin B complex. And that's important to know. I want to say breast tenderness and, enlargement in the men, that might be important for isoniazid, more specific. But I know the peripheral neuropathy is very important to know with isoniazid. And it's very important because of that deficiency of the B complex vitamin. So you know that they're going to have to take a supplement to help with that. So those are more specific for isoniazid. Now, when we're talking about rifampin, the side effects that are specific for that is they can have some abdominal pain. They can have urinary retention, which we know is not good for our older male populations with BPH. It actually, rifampin will stain the skin. Urine, tears, and other body fluids. And I mean, if you're crying, any type of fluids that come out, breast milk, they will all be a reddish orange color. Okay, so rifampin can cause body fluids to be a reddish orange, reddish orange color fluid. So that is something that is common side effect, and after you're done with the medication, it will go away. But sometimes you have to treat the patient. That's not uncommon. It can actually stain contacts and things like that from the body fluids. Now, adverse effects that are specific for that one would be anemia. Okay. Now, the third one is pyrazinamide. Side effects that are more for that is acne, muscle aches and pain, sun sensitivity. But the big thing with that one is increased production of uric acid. And we know if it increases the production of uric acid, that puts a patient at risk for gout. So a person that has a history of gout, pyrazinamide may not be the drug of choice for that individual. But that's the big one, that uric acid production, and that is a common side effect that occur, and they have to watch it because of the gout that can occur. Now, ethambutol, another thing with the ethambutol is it also increases the production of uric acid, which causes gout. So your last two, your pyrazinamide and your ethambutol, all can increase the risk for uric acid production increase, which can lead to gout, and we have to watch with that. And those are both side effects for those. Now, the big thing with the ethambutol, the adverse effect, which is specific for it, high doses, if you're on high doses, it can cause visual changes, and it will actually decrease your visual field. And if this happens, it will actually lead to blindness in the individual. If we catch it early, it is reversible. If not, it is not reversible. So it's very important, people who are on ethambutol, think of E for eye. That's how I remember it. Ethambutol, E for eye, that if they have any visual changes, we have to tell them, if you start getting blurred vision, maybe your peripheral vision is off, you can't see very well. That is very important to make sure they report that ASAP, because we do not want them to become blind. And like I said, that is the big thing with the ethambutol. So remember, E for eye. The pyridium and the ethambutol both do gout, so we have to remember that. That's a big thing. Remember that common side effect for rifampin is, of course, the color change of the urine in the body fluids like tears, sweat, breast milk, and all that can change that color. Remember also with the side effect for isoniazid, the breast tenderness, especially in the males, that's not uncommon. And also the adverse effect that is important for that is that peripheral neuropathy because of the deficiency of the B complex vitamin. So those are some important things you've got to kind of clue out on when you're looking at this chapter. So let's talk about before. What should we do before we give these medications? Well, we need to know what meds they are taking, and that includes the supplement meds because a lot of them can interact with these drugs. So we need to know everything, especially if we need to know, are they taking anything like Tylenol or anything over the counter that contains Tylenol, because we know liver toxicity is a big problem with this. Of course, we would always want to check their liver. We want to do a liver function test to make sure that their liver is okay and make sure it's good before we start the medication. We know if they have an enlarged prostate or male population, or if anybody suffering from urinary retention. Rifampin side effect is urinary retention, so we do need to watch for that very closely. We're also going to make sure we check the patient's lab tests for anemia because the RBCs and hemoglobin and hematocrit, we may want to look at those lab values because we know an adverse effect of rifampin is anemia, and that's important to know. We're going to ask if the patient has a history of gout because we know the side effect of pyrazinamide and ethambutol is uric acid production increase, which can lead to gout. So it's very important for anybody who has taken pyrazinamide or ethambutol. It's very important that we teach those patients when they take the medication to take it with a full glass of water, and they need to drink at least approximately 3,000 milliliters daily of fluids. Excuse me. So that's very important. And also with the ethambutol, we want to make sure the patient assesses their vision because we know the adverse effect of ethambutol is visual changes, which can lead to blindness. So those are some important things that we need to know about those medications. So what do we do afterwards? Well, of course, we're always going to look for signs of liver problems. We're going to check for the jaundice. We're going to recheck those liver function tests. We're going to monitor the urine, monitor their stools, see if they're having pain in the upper right quadrant. See, I'm dry. So that's something important that we have to do. Also, another thing that we have to watch for is our diabetics. We need to report if sugars are elevated so we can adjust their diabetes drugs. You know, we don't ever want to adjust the medication for the tuberculosis drugs, but it can raise the blood sugar for our individuals. So we do have to watch that. Think about it, like infections and things like that. Our body's fighting it. A lot of times our blood sugars will elevate. So we do have to watch for that. And if you're having any peripheral neuropathy, remember that's a deficiency of that B complex. So you're probably going to be needing to take a B complex. And of course, we want to make sure we monitor intake and output. We want them to drink plenty of water to decrease the buildup of the uric acid. And we're going to ask if they're having any pain or swelling to their joints because we know that medication can cause some issues to the muscles and joints. Also, swelling to the joints and pain because that could be also gout. We want to know. So we're going to teach our patients they must stick with that drug regimen. That is most important. They gotta be faithful with it. They can't miss doses because they're considered contagious. Don't take any other drug unless allowed by the physician because, like I said, it can interact with a lot of stuff. You're considered not contagious after taking the med for 2 to 3 consecutive weeks and improvement is seen. You want to stress that they must complete the full treatment, which is usually 6 months or longer. No alcohol while they're on this medication. Avoid it like the plague. Avoid acetaminophen while on this med. Report any signs of liver issues, the dark urine, like colored stools. That's the liver toxicity that we're concerned about. And another thing that's important, and this is one to put on your list of like drinks or foods that you're not supposed to take, you should avoid caffeine products when taking isoniazid because it will increase your blood pressure to dangerous levels. That's important, very important. So if you're on isoniazid, you need to avoid caffeine because it can actually raise your blood pressure to dangerously high levels. We don't want that. And we already talked about if you're on rifampin, expect to see that reddish orange stain to the skin and other body fluids. And like I said, it will stain your contacts. This will become normal after a few weeks after the medication is finished. We have to push the fluids. So 3,000 milliliters of water daily, full glass of water when they take it. Stay out of the sun because we know sun sensitivity. And any visual changes while they're on a Ethambutrol, they need to report ASAP. Now, the pediatric population can take all the meds except for Ethambutrol. They cannot take that. Usually larger children and teenagers are prescribed the same dose as the adults. Now, a pregnant and breastfeeding population, it's approved for active tuberculosis, but you have that high risk for liver toxicity that you have to watch for. And it's very important if they're taking isoniazid, they must take a very, very high dose of vitamin B complex when they're pregnant, a very, very high dose. It does transfer in the breast milk, so you want to decrease the exposure to the infant. And if you do breastfeed, then you must give your infant a vitamin B complex also. So that is very important if they're on isoniazid that they do that. Now, our older population, liver is going to be a big thing because we know as we age, liver goes caca. So we want to make sure we look for signs of liver toxicity. And we're going to see a lot of gout in our older population. But the big thing with the gout with our older population is our patients with congestive heart failure. We have to watch their fluids. People who are on dialysis, they have to watch how much fluid they take. So we want them to drink enough fluids, but they may be at risk for gout. So we have to watch that very closely. And of course, on Ethambutrol, and this is important, when you're on Ethambutrol, the older population, they need to be seen monthly by the eye doctor, especially if they have issues with cataracts or glaucoma, because they need to monitor those visual changes. Because if they don't realize they're having visual problems, then they can go blind because they don't realize it. They think it's a natural process of glaucoma or cataracts. So if they're on Ethambutrol or older population, they need to go monthly for their eye doctor checks while they're on the treatment. And that's the complete treatment. Okay, so that's information about tuberculosis, which isn't too bad. Like I said, I don't think it's a major thing, but there's a lot of things. But just remember the medications for ripe and those few things that I've gone through with you. Now, the next thing we're going to talk about in this chapter is fungal infections. Okay, and fungal infections actually start on page 162 in the book. Now, when we're talking about fungal infections, we know that fungus, they're single cells. They can be multicellular organisms. They spread by spores. So that's how they get. An example would be yeast, mold, mushrooms. I call them shrooms. Mushrooms, they like dark, moist places to grow. They live on our skin. They're in our mucous membranes. And a lot of times when we bathe, they don't wash off. They're a part of our body. People don't realize it. Candida is normal skin flora, which we don't cause problems unless it enters the body or if it overgrows. And a lot of times we talked about when you're not in a bacteria, you kill that normal flora, and what happens is it takes over and spreads, and that's why people get yeast infections. So that's the issue. Our bodies can take control of it, but if it gets out of control, that's when we have the problem. So if it's not treated, it can become widespread. It can go into the bloodstream and cause issues throughout the body. Like I said, if it's on our skin, it can be uncomfortable or disfiguring if it gets out of control. Inside our body, it can cause deep fungal infections, which can affect or destroy organs, depending on where the fungus attacks. Topical antifungals, the same drug used for the deeper infections, but are available like in ointments, lotions, creams, powders, shampoos. They have oral lozenges that you can take in their vaginal suppositories that they can use. And on page 164, let me flip into page 164. On the top, there's actually patient teaching tips for topical antifungal agents, like things that you should do and not. And like I said, just read through it because you kind of need to know how to give things and what you do. Now, remember all the time, we as nurses would wear gloves if we're especially using, putting on creams and things like that. And then you can see also with the vaginal cream or suppositories, that's an important one to look at. Remember that you need to, wash your hands good, insert the, the suppository. It's talking about a full application. Remember, I told you there's like applicators that are plastic that you push up the cream and then you pull the applicator. Of course, you want to clean that afterwards. You may want to tell them to wear a pad because things can, drip out afterwards. And avoid sexual intercourse during the treatment, especially the medications can actually put holes in condoms, so you can have an planned pregnancy. Plus, probably better not to have any sexual intercourse when you have this infection, because anytime if you have a fungal infection, you are higher at risk to spread it to your partner, and they can actually get it on their skin and cause issues. So men can get fungal infections too, not just females. So that's something to consider. And I don't know why anybody would want to do that when they have an infection. That's pretty gross, but each their own. I don't say anything otherwise. I can only teach. That's about it. All right. So, but like I said, it comes in different ways. So read up on those different ways of giving it. Usually our topical antifungals, they don't work well with fingernail or toenail infections. So a lot of those topical things that they put on the things aren't going to work very well. They actually have to take a oral form of it. They're usually, the topicals are used for like superficial infections. So that's one thing. And I know that's a lot of times people miss that in the workbook. There's a question on that. It's always not going to be a topical thing. It's going to be more, systemic. You have to take a pill for it. Systemic antifungals, they're usually fungicidal, so they kill the fungi. There are fungostatic, so they actually will stop the reproduction, slow it down. They're used for deep or systemic infections. Okay, we don't want to use them all the time, but when we have to, we're going to use these. So of course, 6 categories of antifungal drugs, and you can see them all on page 165. And the biggest one, like I said, on this one that we use is fluconazole, and that is diflucan. And that is usually the one that people will say, oh, if I get a yeast infection with an antibiotic, they'll usually order fluconazole, which is diflucan, in order to give it to you. I've given some of the other ones, but that is probably the biggest one that we give a lot of. And we actually will give it for the medications. For people who need it IV, we will actually give them that for a fungal infection. So 6 classes of antifungal drugs we're going to talk about. The first one is our azoles. Second one is polyons. The third is your alamines. The fourth are antifungal antibiotics. The fifth is your antimetabolites, and your sixth is your echinocandins. And like I said, those are on page 165, and I think 166 also is the rest of them. Like I said, the systemic antifungal drugs have more side effects and adverse effects than most antibacterial drugs. The job of the antifungal drug is to kill or disrupt the growth of the fungus. Okay, that's what its job is. But they do have side effects with them. And the common side effects you're going to see is nausea, vomiting, diarrhea, can cause a headache, and taste changes. And I always think of if you have like a fungal infection, your things don't taste right. So taste changes are going to happen. Your hair will get thinner if you take for several weeks. Of course, anytime IV, you can have pain and redness at the IV site. Sun sensitivity, very much sun sensitivity. So if you go out in the sun, you have to be very cautious, wear protective, wear sunscreen, especially if you're taking ketoconazole, voriconazole, and griseofolin. Those are the 3 that you have to be very careful with the sun. Now, adverse effects for these, anemia. Anemia is going to be a big one. Liver toxicity. It can actually cause very low potassium levels, so hypokalemia. They can cause severe rashes, can cause abnormal heart rhythms. It can decrease your kidney functions, and this usually happens in very, very, very high doses, or if you have some type of health problem that causes it. I told you they have very, very bad side effects and adverse effects, and really mostly adverse effects are terrible. They can cause, like I said, the bad rashes. An example of that would be our Stevens-Johnson syndrome, which is Stevie J, and we know that's those blistery rash that covers the entire body and actually could kill a person. Terbinafine, which is Lamisil, And flucytosine, which is anacobon, will actually decrease your white blood cells. And we know if that occurs, that puts you at risk for infection. So we have to watch with that. Your azoles and your ampicillin B, those are excreted by the kidneys and can cause renal insufficiency. So if that occurs, that means you're retaining the drug in your body longer, which is going to cause a lot of kidney issues if you're not excreting it out properly, which will lead to kidney damage, which is a no-go. Griseofulvin, which treats fungal infections of nails, it will actually take for about 2 to 6 months. You have to take it to help with the nail infections, and it can cause big-time liver toxicity, and it can cause paresthesia. And paresthesia, that's the numbness and tingling of the hands and feet. So that can cause with griseofulvin. Now, flucytosine and E-kinocandins can cause peripheral neuropathy, and we know that's the loss of sensation in your hands and your feet. Your azoles will cause big-time cardiac dysrhythmias, so people need to monitor their heart rates. And your E-kinocandins actually will increase the rate of clot formation, which puts patients at risk for DVTs. So that's for the E-kinocandins. Now your ampicillin B, it has the most adverse effects of all of them. It's only given with a life-threatening fungal infection. Fever, it can cause the fevers and chills, and usually they nickname it the shake and bake, okay? It can cause the red man syndrome, which is the dilatation of the blood vessels. It can cause the, flushing of the skin. It causes hypotension. It can cause shock, and it causes anaphylactic symptoms. And the bad part about ampicillin B, and like I said, this is the last resort, really, really bad fungal infection. People could die if they don't get it. They'll get this ampicillin B, but all the side effects and adverse effects that occur with it. This adverse effects of the shake and bake with the red man syndrome and the hypotension can cause shock, anaphylactic symptoms. The bad part about it is when we give it, the half-life of this medication is 15 days. So every 15 days, half of the medication goes out of the system. Another 15 days, another half goes out. So it takes a long time to get out of the system. So a lot of times you will see these side effects and adverse reactions for weeks to months after you finish the medication. And people have to be aware of it, that this shake and bake can occur later on. And that's the worst thing I can tell you about ampicillin B is that shake and bake, but it causes all those issues with it. And that's important to know. Important. All right. So what are we going to do before we give these meds? Well, if you're taking any drugs or supplements, we need to know that, anything over the counter. Patient is not anemic or having any liver problems, we definitely want to make sure we check their hemoglobin hematocrit, the red blood cells, do a blood count, do a liver function test before we give them. We know that it can affect the kidneys, so we're going to be checking a BUN and creatinine level, check those kidney functions. You can take these meds with or without food, depending on how things go. Azoles. Azole, the activity can be decreased with grapefruit juice. So no grapefruit juice with azole. So mark that on your food list and your drink list. Ketoconazole, my goodness, I can't even say it, is activated by the stomach acid. So you don't want to give if on any meds that reduce acid production, like Nexium or something like that. So never want to give ketoconazole with anything that will decrease acid production because that's how it is dissolved. Before you give ampicillin B, you may want to pre-medicate to prevent some of those nasty effects that occurs with it. So they may medicate you with subdiphenhydramine Benadryl to make the side effects and adverse effects reduce a little more. Afterwards, if you give it IV, we're always looking at the IV site for any signs of issues. We're going to check the patient for any allergic reactions. We're going to monitor the skin for rashes because we know CVJ is a big issue with that. We're going to be looking at the liver, checking for jaundice and all that. That's important. We know that it can cause heart problems, these meds, so we're going to monitor the heart rate and rhythm. And we're going to make sure we recheck those lab values, white blood cells, red blood cells, hemoglobin and hematocrit, platelets, BUN, creatinine, and potassium. Don't forget the potassium because we know that's a bad thing that occurs. Always check intake and output because we want to make sure the kidney functions are good. Terbinafine or flucytosine, we're always checking for new signs of infection. Echinocandins, we're always checking for signs and symptoms of DVT. So if people complain of like tenderness in their calves, maybe they have like cords going up, like these thick cords that are following a vessel. Maybe one leg is bigger than the other. A lump, something. They need to get checked because they're at higher risk for DVTs if they're on the echinocandins. And of course, ampicillin B, we're checking the blood pressure. We're looking for signs of shock. We want to make sure the pulse ox below 90, if they have a rapid heart rate, rhythm, shallow respirations, their urine output decreases, any change in mental status, their blood pressure drops more than 15 millimeters of mercury below normal blood pressure. Those are things to notify immediately because they're having issues with that ampicillin B. We need to really monitor them if they're on that medication. That's a big, big one to watch. That's the last resort. Of course, we're going to tell them don't take anything, especially over-the-counter meds, unless it's okay by the doctor. We already talked about take with or without food the meds, but no grapefruit juice if you're on azoles because it will decrease the effectiveness. We're going to have to teach our patients how to take a pulse and feel if it's irregular. And if it does become, we want to make sure reported heart rate is greater than 100 or less than 50. We need them to tell the doctor ASAP. Any signs of jaundice, those dark stools, light urine, dark urine, light colored stool, we want to make sure that they report that because that's signs of liver issues. And of course, they're at risk for anemia. So we're looking for signs and symptoms of being fatigued and weak, pale, very short of breath, and increased heart rate, because that's just signs and symptoms of anemia. Plus, we can check the hemoglobin and hematocrit levels. Always looking for rashes or lesions because that could be CVJ that occurs with it. And they need to protect themselves from the sun, especially, like I said, if they're on the ketoconazole, voriconazole, or griseofulvin. They need to stay out of the sun because they will burn quickly. Terbinafine or flucytosine, if you're on more than 1 week, their resistance is going to be low and they can get infection. It will decrease their white blood cells, so they have to remember to avoid big crowded areas and stay away from those little dirty grandkids and kids. So we do have to make sure we tell them that they're at high risk for getting infections. Now, the pediatric population, terbinafine is usually prescribed for ringworm of the scalp. Usually this is for it. It's a granule that should be sprinkled on food that is non-acid and swallowed. Okay, so that is one thing you do need to know. The terbinafine for the pediatric is prescribed for ringworm of the scalp, and it's a granule and it should be sprinkled on the food, and it can't be an acid food, anything with acid in it, and then you swallow it down. Pregnant population, not recommended for the pregnant population. That's all we need to know. Don't do it. And then our older population, last but not least, our ampicillin B, it can have a lot of neurological changes on the older population. So it's very important to know what their normal mental status is, because with them, it's going to be a lot of neurological when they have that. So they can become very agitated. They can have problems thinking, anxiety. They can actually have a stroke. They can go into a coma, confusion. They're depressed. They can have blurred vision, dizziness, drowsiness, hallucinate, hearing loss, as well as the peripheral neuropathy. So ampicillin B, even though we use it for big time infections, if we give it to the older population, we may expect to see some neurological changes. So always know how they normally act at the beginning, because that's going to tell us if something's starting to develop. And of course, with our older population, echinocandins we already talked about will put you at high risk for DVTs, and we do need to monitor the patient for that one. So that is basically it for chapter 10 about tuberculosis, as well as your antifungal drugs. And if there's any questions, don't hesitate twice. Please talk to me. Okay, guys, have a good one, and I'll see you in class.